Then availability, because tooth, even after the disaster has occurred, uh, all other body parts are mutilated, then also there will be greater chances of teeth to be available, and it is resistant to decomposition and trauma. This picture is from a real incident. This happened like a light flight, like only one passenger, like a personal flight, like passenger traveling from from a place called Tamil Nadu. I don't know where the place is actually. I read it in an article. This means how intact the tooth is there, of the both persons. So in this picture, this is the identification of the pilot and the passenger using the dental structures, dental restoration. You can see that dental fillings are there. So using that,
Ma'am,
yes.
again I am stucking at 8 number slide.
Oh God.
Slide are not moving.
Okay. Is it changing now?
Yes, ma'am.
Okay, fine. Don't know, something wrong happened. Now it's changing. Okay. Okay, I have explained about this picture now. So you can see the two oral cavity, that is from these remains are got from that scene of crash. So one belong to pilot and one belong to the passenger, and you can see the dental fillings here. You can see the dental filling. So this helped in identification. Coming to types of dental identification, slide is changing now. It
No,
changed.
ma'am.
No, it's not changing.
Should I share the screen, ma'am?
Yeah, Nitish, can you
Okay,
share?
sure, ma'am.
Thank
Just a
you.
second.
Thank you. Thank you. Okay. Thank you, Nitish. Types of dental identification. There are three types of identification, and first one is comparative identification. In comparative identification, the word itself denotes like comparing ante-mortem dental records, that is the dental records which are present before death, with the post-mortem findings. In post-mortem we have that findings, we'll get the we'll see the remains and we will note the findings, so we have to compare both. That is the comparative identification. So it goal of this thing is for the identification of specific individual. We can identify it belongs to this individual or not. And in second type is reconstructive identification. So if no antemortem records are available, then we have to solely analyze on dental features to predict age, sex, ancestry, socioeconomic status, dental treatment. So I will tell that uh, age estimation, for example, age. If we get a tooth, or if we get a jaw containing tooth, we can do age estimation methods. Radiographic methods are there, morphological methods are there, histological methods are also there. So we can estimate the age. Then sex of the individual can also be estimated from this remains, that is tooth and jaw. Then ancestry, to an extent we can find. Then socioeconomic status, if that also to an extent, not completely, we can get that idea of that. Then any dental treatment history also we can get from that. Any kind of filling is there, any kind of processes is there, or any orthodontic appliances is there. And we get like habits. We see that people who always who do the pipe smoking, or have that bruxism, means the sleep, night grindness, night grinding. You know, some people grind tooth during sleep, that is known as bruxism. So their tooth surface will be like no cusp will be there, that will be reduced, like flat surfaces will be there. And we know tailors they used to bite like keep their needles on the in between the tooth. Or beauticians, those who you have seen, they're doing the threading of eyebrows, they used to hold the thread with the tooth. So there will be notching on the front teeth or incisors. So from, if we get a notched incisors, we can roughly we can get the idea of habit of that individual. So this kind of reconstructive identification is useful when I have told that AM records are not available, and it helps to narrow down the possible identities. Okay, change. Last one is exclusionary identification. It helps to exclude. So for example, one we get one remain or one evidence from the from a place, then there are multiple missing persons in our list. So we have to exclude. Maximum we will can do the elimination. So this is the process of eliminating potential matches between these findings. Change. Postmortem data collection. So this what are things we do in postmortem data collection? Detailed examination of teeth and surrounding structures. We have to detail each and every tooth must be detailedly evaluated or analyzed, and document which all teeth are present, which all are missing, and which all are unerupted. Unerupted means the tooth which not come out of the oral cavity. And missing means, usually we say missing when once the tooth was there and it was lost by removal or any kind of trauma, like that we indicate the missing. Then restorations, like any kind of fillings are there, crown bridges, these all are common terms we come across in dentistry. And any kind of cavities, wear patterns I have told before, like attrition, abrasion, like that. Any anomalies, like some tooth will be large in size, macrodontia, microdontia, or additional cusp is present, or any distinct tooth morphology or anomaly is present, we have to note that. Then pathologies or trauma. Change. Nitish, can you please change? Nitish. Okay, thank you. Then radiographs. Radiographs Different types of x-rays are there in there is small or bite wings are there, and the big ones known as two graphs, that is IOPA, and the last it X-ray. So just by oral cavity, we only able to see the structures which inside the jawbone. If we have to analyze it, the in the first X-ray, everyone we can see as well as you can see the color. Um, that white structure, white color, that is root canal treated or endodontically treated tooth. And adjacent to that, there is a premolar. You can see a filling or restoration, which is also radiopaque or white in color. That white indicates that something foreign material that is filling only. And in the third picture, that is known as implant. That is implant placed in the oral cavity. So we'll get any kind. We'll we find if we find a tooth from outside, maybe someone out of the dental field cannot understand the tooth is endodontically like RC treated or not, root canal treated. But if we take the X-ray only, we can see that clearly. We can see that the particular tooth is endodontically treated. So these are all unique features you can be identified from radiographs. Photographs, high resolution images must be taken, and it is used for visual comparison. Change. Mm. Then odontogram is a charting tool that is used to document dental findings visually. We can see that all the features are odontogram code will be there, like caries. There is given particular codes for that, and you normally dentists put these codes to uh, denote what is that missing is there, or danger is there, any kind of stain is there, metal restoration, like that, any kind of calculus, any post crown danger is there. So everything can be mentioned using this odontogram codes. And also tooth position, condition, treatment, everything, any anomalies or distinguishing features, this can be represented using odontogram. So that we learned about the post-mortem phase or post-mortem data collection. So this that was important. We have to note each and everything which are seen from the available remains. What all things are there, we have to note it down. Then anti-mortem data collection. In anti-mortem data collection, we need to look for dental records. Now I'm just telling about the anti-mortem dental data collection only, not about other medical records. I'm just telling about the dental records. Then radiographs, because we know if we take a treatment in a dental clinic or dental hospital, they will have the dental records with them, and the radiographs will be there. X-rays, they will give the X-rays to us, and they will keep a copy of, or even the soft copy or hard copy, they will keep with them. One copy will be mostly there with them. So that is the radiographs. Then orthodontic appliances. Orthodontic appliances or models. In the picture, uh, mm, okay, in this picture, you can see the first one is a dental record. In that dental record, top of that, X-ray is also attached. And in the second picture, that is all orthodontic models. Like if we do a dental alignment treatment that is known as orthodontic treatment. The dentist have the study cast and models with them only. So that will be very much useful for the identification purpose. That's the third picture also about the dental cast. If anyone has visited the dental clinic for treatment, they might have seen this dental cast. And adding on to that, other things are prosthesis. I have not included the picture. You might be knowing the set of artificial teeth. The full set tooth will be there, and sometimes it will be partial set. This is known as partial denture and all. Okay, change. Matching process. So this is quite interesting part. This matching, superimposition, charting, and unique features. Like superimposition, I've shown the picture. Um, Antemortem X-ray is the first one. In the just focus on the first picture, we can see that antemortem X-ray, and it contains both the upper and lower jaw, lower teeth, and postmortem X-ray only present for the lower teeth. Okay, are you able to see the white color, the opaque structures? That opaque structure is fillings or restoration. Okay, just focus on the shape of the filling. You can see the shape. So in this case, the shape of the filling is analyzed. The technique is given in the second picture, that is the big picture. It is in that antemortem X-ray, postmortem X-ray superimposed, and this is superimposed as negative. So you can see the shape of the restoration or filling clearly. So if it is exactly superimposing on that and the shape is exactly same, the matching can be done like that. Any doubt in this picture? This matching process? You can put in comment box also.
Ma'am, third one.
Like third one. Okay. That is, we want to one thing we can directly match also, but superimposition will be the better thing. So side by side comparison can also be done. The first picture actually side by side comparison only, but in the third one actually the there is negative. We need to take the negative of the restoration, because in X-ray, the in radiograph only it will be seen as the white color, that is radio opaque. So we can use any kind of software tools like that to change it into negative. And so in negative you can see that the restoration is or filling is appeared to be in black color. Okay, and this black color is subtracted, means that is if that portion is subtracted, you can see that the like that shadow of the restoration, you can see that is perfectly fitting into the actual antemortem X-ray. I hope it is clear now, Navneet.
Yes, ma'am.
Okay, that is how the matching is done. Side by side comparison is also done. It's easy, but for what we need to confirm it, then this superimposition is the best part. Change. Okay, this is also matching. So this is an first picture, that is two antemortem OPG X-ray. Okay, and upper teeth also there, lower teeth also there. Hmm? And in postmortem, the if we got the missing persons any kind of remain, if the intact jaw is, in this case full jaw is intact, we can see that all full jaw is present. So this is the CT MPR of upper teeth. MPR means multiplanar reconstruction. It is CT only. So this is CT and one thing is OPG of the same. So we have to find it belongs to the same person or not. Okay. Just have a look on the yellow arrows only. Yellow arrows. Okay. Indicate the corresponding, particular corresponding tooth with the dentist. Is that okay? Fine. Then focus on the red arrow. In antemortem X-ray, the first picture, you can see a red arrow. There is a tooth also present. It is that is I think it's canine tooth. Okay, but in the CT of MPR, there is missing tooth. The tooth is missing. Okay, the tooth is not present, so it is missing. Red arrow. In the next thing, can you see an orange arrow in the lower teeth? AM OPG X-ray of lower teeth. Can you see that orange arrow that is focusing on a lower teeth? Exactly, Nidish, that one. Okay. In you can see in that the radio opacity, that is white color, is more pronounced, but in CT MPR of lower teeth, that orange arrow, please show that orange arrow point on that. Okay, you can see that color is reduced, white color is reduced. That means some replacement of restorative material is done. Okay, now we can if we so in this case there was the presence of dental record because we got the antemortem X-ray, so surely antemortem dental record will be there. In the antemortem dental record, it was clearly written that red arrow indicate the tooth and the patient came for extraction or removal of that tooth, so the removal was done before death. So that is why that tooth was missing in the oral cavity. Then, according to the lower teeth, that orange arrow, there was previously one kind of filling and it was replaced by another filling material. Different filling material have different density and different radio opacity. And it was also written replacement of filling was done on that lower teeth. So that is how the matching is done. Corresponding teeth are looked and also missing tooth is there. And where is that missing tooth? So why is it that missing? So we check the dental record. So we get the idea of how it got missing and all. Okay, that is how matching is done. Okay, proceed. We'll proceed now. Time is going. Okay, this is just an flow chart. Okay, change it. No need of the explanation, further explanation. Change. Okay, this is very important. DNA from teeth. It's actually a big topic, but I am just one or two sentences I'll explain. Teeth is very important DNA source because I have told before that hard outer enamel protects inner pulp and it is ideal for preserving DNA. And nuclear DNA as well as mitochondrial DNA can be extracted from tooth, and it is very critical in identifying decomposed or burned remains. Okay, this picture depicts how DNA is taken out from tooth. Okay, extraction process, only the DNA extraction process is shown here. An analysis part is different. Okay, that that is much more learn is there to learn, but only just for the time being, just understand DNA can be extracted from tooth. In I Okay, in the chat box, questions we'll look in the at the end of the session. Okay, change. Okay, tools and techniques. Imaging tools are there. Then software and databases, analytical tools and data sharing. Imaging tools and software we'll discuss in detail. Analytical tools are just what all the analysis tools are available in forensic odontology. That all belongs to the analytical tools, and data shared according to Interpol protocols. No forensic odontologist or anyone in the DVI team can do like their own wish. They cannot do like that. They have to find. We have to um, write or document according to the protocols. Even the data sharing is also according to the protocols only. Imaging tools, I'll show the pictures of what are the tools. Change. Okay, first one is, these all are like portable radiographic units. First one is handheld X-ray device that is very much easy to carry on to the scenes. Then this is belongs to Nomad. This Nomad is much useful in 2004 tsunami. In 2004 tsunami, these handheld X-ray devices played an important role in identification. Okay, and the second Nomad Pro is also there. That is much more advanced version. Then rest of the three images shows portable X-ray units that is belonging to Min X-ray. That's just the company name only, Min X-ray. Okay, change. Then CBCT, that is CBCT scanner machine. And down the skull picture, you can see that is how a CBCT radiograph will be looking like. It gives a 3D representation, so you can zoom in, zoom out, rotate and all. Okay, that is how a CBCT. So we can analyze any kind of anomalies, any kind of pathologies, any kind of injuries also from this, because 3D imaging is there. And intraoral scanner, then extraoral or surface scanner. These all are the pictures, okay, of the tools used, devices used. Change. And talking about the software, this is given by the this is standard globally recognized databases used. That is, WinID is a dental computer software that assists in forensic odontologist in this kind of identification purpose. It uses both dental and anthropometric characters. Then DVI System International. This is also a software. This uses that Interpol. This Interpol gives standard protocols for using this. Okay, change. Just talking about the role of Interpol. Interpol DVI. This provides internationally accepted protocols, because all nations follow these Interpol DVI protocols actually. So consistency, it can ensure the consistency and cross-border identification. If a disaster occurring in one country, so another country DVI can also work on that. Like Interpol will send their DVI teams to the countries which are in need of the support, and they also conduct training, simulations, and DVI teams. Interpol has given a disaster victim identification guide. If you can download it from Google only, and you can read it. Actually, the everything what it is crystal clear. It is shown that what all the protocols should be maintained. And this picture shows the Easter bombing Sri Lanka 2019. Actually, Interpol DVI helped in identification. Change. This is Interpol forms. There are a lot of forms actually for whole body, but I have included only the dental forms. This yellow one belongs to antemortem form, dental form, and this one pink is postmortem form. Change. And what are the challenges? We know fragmentation. We get not be There is very less chance to get the fragments. Change only, but even from the fragments, we are able to identify individuals. Then burning commingles, we know that it will be like mixed up, piled up, so it is very difficult for that time, but anyway we have to identify. And lack of antemortem data, I have mentioned that this is most challenging. If the person has in the absence of antemortem data, it's very much difficult for the identification or dental work alteration. Change. Okay, ethical consideration. Chain of custody should be maintained. Each and every step we need to maintain the chain of custody. And confidentiality is very much important in a DVI. If you know the person, if we identify the person also, we need to either shout out that he there are true in postmortem handling. Change. Veterinary, forensic pathologist, anthropologist, so everyone will work together for and future, that is AI in verify and all, we can use AI for that. In comparison also AI will be assisting. It's all future perspectives. And digital forensic odontology, it can replace the manual methods actually, so the identification will be more quicker. And few case studies we can look. This I mentioned 2004 Indian Ocean tsunami. In this case, actually, thousands of victims were identified using dental data. This is also very much familiar. 2001 made, and most of them was through in 2011, and it was very massive disaster and dental damage and decomposition. Um, from change. Okay. For summarizing, we can say that teeth are critical identifiers in TVI. So, with structured methods and reliable tools and multidisciplinary effort, forensic odontologists provide closure and identity when all else is lost. Okay, thank you. Thank you for listening. Sorry for some troubles, technical troubles from my side. Okay, now you can ask the doubts. I'll try to answer my best. If anything, if I am not able, then I will refer or I'll discuss with my seniors and I will answer it and I'll connect with you. Okay.
That was an insightful session, ma'am. Thank you so much. We will begin with the Q&A now. If anyone has any questions, you can unmute yourself or you can even type in the chat box. And we already have few questions in the chat box, ma'am. Should I read it for you?
No, I will read it. I will read it. Okay. Uh, so antemortem, I think I mentioned it. Like antemortem dental records are not available. In that case, we only depend on what data we get from the remains. So that is why I mentioned about like age estimation and all. If we get a tooth only, we can do the age estimation. If we get the jaw only, we will take the radiograph and we can do the age estimation. And in like sex determination, odontometrics plays an important role in sex determination. Odontometrics means the measurement of tooth. So tooth measurements, if we get the like in the like canine width and all, or mesial canine index like that, so many things are belong to this odontometrics, so we can clearly find sex also. And if we extract the DNA, presence of amylogenin gene or presence of bar bodies, so we can estimate sex from that. Okay, so if antemortem data are not available, then only we can look for what we have. So if we have that, we will give that this person belongs to this ancestry or particular age group or particular sex, like that. From the remains we get. Okay. Clear, Kushi? Clear? You can respond in chat box. Okay, fine. Preeti. Ma'am, as we know that, okay, I'll read it. Casting, I'm not able to understand that. Okay. Cleaning, no. Cleaning is just we remove the. I hope you're talking about the dental treatment. In dental clinics, we do the cleaning, filing, etc. Okay, fine. Cleaning will not alter the tooth morphology. Okay. There is a taboo like that. If we clean the tooth, enamel is lost. Nothing like that. We only clean the calculus or debris present on the tooth. So, and it will be mentioned in the dental record only. So that will not alter. But casting, I'm not able to understand casting. You are talking about the taking of impression from the oral cavity. No, that will not change the uh, morphology or anatomy of the tooth. Then filling. Fillings are very important. If fillings are there, then it will be clearly noted in the dental record. Filling is done in relation to this tooth. If I am doing a filling on my central incisor, like in the first quadrant, like it will be mentioned like that, restoration done in relation to 1 1. 1 1 means the central incisor. So in the dental record it will be visible. So it helps in identification only. It will not hinder the process. It helps only. Okay. Then can Okay, Saheli. Real life, we cannot only solve case based on bite mark analysis. Actually, bite mark analysis, we all know that in Nirbhaya case, Dr. Rashid Ajarya, a well-known forensic odontologist in our country, he done this analysis. It took almost 3 4 days for the analysis and documentation or completion and all, and it helped in identifying because there were a lot of bite marks present on the victim's body, so it was used for like um, secondary evidence, we only if bite mark is there we cannot conclude that it belongs to the suspect only, because in every cases there will be other evidences also. This will act as supporting evidence actually. And I have one case in Kerala actually 2014, I think, one murder case, assault and murder. So this was Jisha murder case. I hope someone from attending from Kerala might be very familiar with that case. So in that particular bite mark, there was spacing between the front tooth. In terms, we say that in dental terms, it is known as midline diastema or median diastema. So in the bite mark, it was evident that the suspect have a big spacing in between the two center tooth in the front tooth. So it helps in actually drawing the sketch and all. Draw a sketch was there put, and it helps in the identification of the suspect. So that is how the bite marks are important. Himanshu. Um, Amalgam is basically, mercury, silver amalgam, we say mercury, but amalgam is most resistant, uh, in my opinion, as if now, if there is any change, I will tell you, okay. But amalgam is banned, actually banned in many countries. In India, we still use in dental colleges and all, we are still giving amalgam registrations, but in most of the countries, amalgam is banned. some other materials are there, GIC and all, but amalgam, like it is it contain mercury and also it is most resistant in my opinion. If any changes there, I will refer and I will tell you. Okay, Himanshu, keep in touch. Okay. Okay. Uh, Before that, Shivali, X-ray films, it will help in personal identification. Um, if only the small IOPA films are there, then also if particular dental features are there or particular fillings or implants or something is there, it will help more. But in OPG and all, every time our name, age, age or date of birth, then sex, that this all personal details are already embedded in the X-ray. And if it is lost, also only the tooth part is there. Also, yes, we can. It helps in identification. We can go for identification. Examples. Okay, I'll tell a recent example. Our Ahmedabad plane crash only. I hope most of you have read in the news about Dr. Jaishankar Pillai. He is actually our senior. He also alumni from NFSU, and he done this dental tooth extraction. That is for DNA, dental DNA extraction. He helped in that case. So this is the most recent example I can tell in mass disaster. There are then in 2007, 2000. I don't remember the year, 2010 maybe. I am not able to remember the year. I hope you might be remembering about Mangalore air crash. There also forensic odontology played a role in dental identification. That's DVI, human identification. We have a question. Can we identify a dead person by their dental records if all of his or her teeth were removed by the killer? Okay. If tooth is removed, mm, DNA extraction is difficult. So, but only tooth is removed. If jaw is present, it can help. What this upper jaw and lower jaw, especially this mandible, lower jaw, it helps in mm estimating age as well as gender, and studies are going on in other identification features also. Okay. No, no. No, Navneet. Actually, in India, the actually forensic odontology is not so developing because of the absence of proper dental records. But recently, but no such database or like that is not there. But then only dental clinics or but all dental clinics does not provide um, like this kind of antemortem record actually. Some dentists only write in a piece of paper and they will give it. But recently, most of the clinics have that softwares and using digital systems, so it will be helpful only. Okay. No such organization is there to maintain a dental database. Actually, this is a good idea. So, Navneet, we will try for making a dental database. How does the identification of ancestry take place? Okay. Ancestry identification, like in forensic odontology, we not from exactly from the tooth actually. Tooth there is like tooth size and all can different in different races. It is different, but mostly That is anthropology part. Forensic odontologists also get expertise in anthropology, so that different cranial measurements can help in identification. Then jaw, anatomy of the jaw. We have seen that in African population and all, the Negroid population, we can see that the jaw, very prominent jaws, and chin very prominent like that, or prognathism is present like that. Jaw features are there. Otherwise, craniometrics, anthropometric measurements are used. And also, in some places, we can see that like dental jewelry, not the exact thing what we are seeing in the modern days, like dental, like alter, what that is, as a part of their culture, they make holes on the tooth and put some jewelry on that, or some kind of alterations, that intentional modifications, yeah, that is the term, the intentional modifications, in some culture, in some societies, in some tribal groups and all, we'll do the intentional cultural modifications. So if we get the like that samples, so it will help in identification of that particular race, particular community or culture. There are a lot of studies available in the literature like that, alterations, cultural modification, like that.
Do we have any more questions? You may please unmute yourself or type in the chat box.
Someone please unmute and make the session bit interactive. We can take, I think, 5 more minutes for this. Or just tell me, have you understand anything from the session? At least what is okay, Arshad. Okay, Arshad. Without any professional supervision, yeah, we see that people doing modifications. So this actually, if the modification is done, and the anyone close relative or friends, if they know these things, then it will be useful. Other thing is social media. Just an extended version I am saying. We all take selfies, photographs, and we post it in social media, so it will be there. So if one person has done the, and they put the smiling face with the teeth visible, and like, it is also used actually, can be. But if no one if I have done an alteration, but no one know that I have not posted any picture, or I have not I'm not telling anyone, and in that case it will be difficult. Otherwise it's it got damaged and we want to reconstruct it. Okay. um Actually, reconstruction, um we can go for, um, like, for example, in forensic facial reconstruction, whatever is the remain is there, we cannot do on that thing. That's the evidence only. So we will go for a scanning, 3D scanning, and we'll make a 3D print of that. And on that 3D printed model, we will reconstruct things. For example, in facial reconstruction only, I'll say that damaged dentition, I have not seen that we are not reconstructing that thing. Usually we do the facial reconstruction. In that, there is standard measurements given, and according to that we'll put the thickness, that is depth markers and all, and we'll put the facial features like muscles and about that using clay, and there are a lot of methods for reconstruction. Then superimposition also there, but damaged dentition I'm not done that type, because dentition is much more very unique. So if we construct also, there is less chance that it is not proper. There will be anomalies, uniqueness, rotations, crowding, spacing will be there. So identification mainly based on what all present in that. Any direct internship opportunities in forensic odontology? In forensic odontology, direct internships, it's very difficult because most of the FSLs don't have the odontology department. In India, actually, NFSU is providing this full-time course for odontology, and some institutions are providing fellowship or short-term courses only. And in AIMS, Bhopal AIMS, and in only few institutions have the odontology department. In Dharwad, Dr. Rashid Ajar is having, but I am not sure that he's giving internships, but he's providing short-term courses there in Dharwad. You can check on that. Dr. Arshid Azaria he's providing short-term courses only. Internship, I am not sure. Okay. DNA extracted. Okay. You can contact me on LinkedIn, or I will I'll tell more about that in personal. Okay. Then DNA extraction. Okay, DNA extraction. I'll tell in brief. If we get a tooth, DNA is present inside. That is, tooth is made up of outer covering is enamel, inside dentin, and most inner part is the pulp. Pulp is the living tissue that is containing blood vessels and nerves. So from the blood vessels, that from the pulp mainly DNA is extracted. Okay, we have to either cut the tooth vertical or horizontally cut, directly extracted. Otherwise, we have to crush the entire tooth, known as grinding. There is normal grinding is there, or we have that cryogenic grinding, that is machine assisted grinding in extremely low temperatures, and from that powder, normal DNA extraction procedure, DNA department, what we are doing now, so that can be done. That is how DNA is extracted from tooth. Usually I have seen in FSLs and all, they go for cutting the tooth only. And the other thing is, I have shown in the picture like drilling, making a cavity, that is known as access cavity, access into the pulp. So an endodontic access cavity is produced using the burr. Burr means that is handpiece, like one instrument. You can drill the tooth, and an instrument is their file. File is put into the um, pulp chamber, and pulp can be extirpated, and further analysis can be done. This is how. Thank you so much, guys, for listening patiently.
Swarangi, please proceed.
Thank you, ma'am. We sincerely thank you for taking your time to share your expertise with us. As a token of our appreciation, we will be presenting you with a letter of acknowledgement for your valuable contribution. On behalf of the entire Krino Forensics team, we extend our heartfelt thanks to our speaker and all participants. We hope you found this session enriching. Please stay connected with us on social media for further updates and have a great evening. And for the certificates, you may fill the feedback form. It will be shared with you.
Thank you, Swarangi, for concluding. Thank you guys for joining. This is Nitish Singh with his team signing off for today. Thank you.